Now, we want to talk today about prostate conditions. Now, we said prostate cancer, but in fact, it'll cover a lot of conditions, including prostate cancer. And though it's a one would argue that it's a male problem, it's something that everyone should know about, because all males come from mothers, and women have husbands, and so this is not something that would necessarily make it less easy on a female. So when we talk about protecting men's health, and we talk about prostate cancer, we will cover some of the other subjects as well, but it is a subject for everyone, for sure. So let's go, because it's a lot of material, and I want to cover it in as adequate a time as I can. So when we're talking about the prostate health, first thing we have to do is define what is the prostate gland. And you see the prostate gland there. The prostate gland is that organ that sits just below the bladder and just around the urethra, which is the tube that passes through the male sex organ. So it surrounds the urethra. The urethra is the tube. So that's the tube there that passes through the male organ. And that's the prostate gland there, and it passes right, the urethra, the tail end of the urethra that goes into the bladder, passes right around the prostate. Now, that's important in terms of understanding what symptoms would be there. And the urethra is what carries both the semen as well as the urine. And here it is this is the bladder, it's just above the bladder. And it's above the pelvic floor muscles. So that's what the gland is. The normal size of a gland is like a walnut. So if you have any walnuts, or if you ever seen walnuts, that's the actual size of the prostate gland. It's the size of a walnut. And that's the size of a prostate gland in maybe a teenager. But as you get older, that becomes bigger and bigger. It becomes larger and larger. And the prostate produces most of the fluid. It makes up the seminal fluid. So the so-called semen or seminal fluid, most of that liquid comes from the prostate gland. So very important in the reproductive cycle. Then you also have the muscles of the prostate. So it's a very muscular organ. Not only is it important in producing seminal fluid or secretion, the muscles are also important in the ejaculating process, so that the semen can get transported into the female organ, and then from there, of course, gets involved in the reproductive cycle. So it's important in terms of not only the fluid, the seminal fluid, it's also important in terms of the muscular contractions that you get. It's a very muscular organ. And in addition to that, it also has a sphincter. So the sphincter is very close to the bladder here, so that when there is the ejaculation process, when the seminal fluid is being released, the sphincter at the top of the prostate gland, right at the base of the urethra, by where the bladder is, closes off. And that prevents the semen from going backwards into the bladder instead of forward to the outside. So the prostate gland is quite an important gland. It serves multiple purposes in the area of the reproductive system, in particular, reproductive tract. But it also is important in production of testosterone. Testosterone, as you know, is the male hormone. That is what gives the androgenic effects on men. You know, male hair, male type, pattern, baldness. The sex organs and so on. And the prostate gland is an important gland in that whole mechanism. It transforms testosterone, which is produced by the testes, into a biologically active form called DHT, dihydrotestosterone. So when the testes produce testosterone, some of it also comes from the adrenal glands, by the way, the prostate is involved in converting it into a biologically active form. And it is that biologically active form called dihydrotestosterone which is the androgenizing effect. So in other words, that's what gives you male puberty, and that's what help boys to become men, and they get a deep voice and all that sort of thing, and the muscles and so on. All of that comes from the DHT, but the prostate gland is important in that process. So what we have just done is identified what the prostate is, where the prostate is located, and what is its function. Now that we have done that, let's look at some common prostate health problems. These are very important to all men, but again, as to say, women who have to take care of husbands or fathers or young children or boys, this is important information. So the most common one is called benign prostatic hyperplasia, or sometimes symbolized BPH. And that happens when the prostate gland becomes too enlarged as a man gets older. So one of the things is, as you get older, as a male gets older, that gland gets larger and larger. Now here on the inset, you would see this enlarged prostate gland here, and that's the bladder above here. So it's a cystoscopic view. So that's the bladder, that's the urethra, and these large prostate glands are squeezing the urethra and creating a valve-like effect. And so it becomes very difficult as you get older. Because of the enlargement of the prostate, you start having difficulty passing urine. So that's one of the characteristics as you get older. You get compression of the urethra. The male finds it difficult to pass urine. And you get risk of bladder infections, bladder stones, because the urine is staying in the bladder too long. And of course, you get a number of other circumstances with hormonal changes. You get excessive estrogen deteriorating the blood vessels, you get zinc deficiency. All of that happens because the body is not utilizing the hormone as effectively as it could, and the gland is now becoming dysfunctional. So lots of things you see as men get older as a result of the loss of prostate function. The swelling up, the enlargement of the prostate, loss of hormonal function, the production of excessive estrogen that can give you problems with the blood vessel system and zinc. So when does this happen? When will this start happening? Well, as an age-related phenomena, benign prostatic hypertrophy, now this is benign, it's not cancer, this is not a cancerous one. It starts happening from the time you hit about 40 years old and getting older. You start getting that enlargement of the prostate lobules, those prostate glands, which comes in different parts. And you start getting this sort of active compression of the urethra. It's an inevitable one. So if you look at what statistically, 10% of men in their 30s have benign prostatic hypertrophy or BPH. 20% of men in their 40s have it. 50% in their, to 60% in their 60s, so that's half of men in their 60s have problems with the prostate. 80% to 90% of men who are in their 70s or 80s. So by the time you reach 70 or 80, practically every man is struggling with BPH. That's just that common. It's a natural physical, it's like it's aging. You can't stop it. It is a process of aging in that sense. And of course, the symptoms that they will present with will be lower urinary tract symptoms, quite often pain related to urination or frequency of urination. That's why as the man gets older, he gets up several times during the night to pass urine. But that's because the urethra is being compressed and he's not able to void completely. So the reason you go to the toilet or to empty your bladder is you have a sense of fullness in the bladder. And because the bladder is not emptying properly because of the benign prostatic hypertrophy, it fills up a lot quicker because you have a residual amount of urine remaining in the bladder. So you pass urine out, but you're not emptying, you're not voiding completely. So the bladder fills up a lot quicker now because you have residual urine, and therefore you go to the toilet frequently because the bladder has the sensation of its need to empty. So you get urinary tract symptoms. And that's BPH, benign prostatic hypertrophy. Again, just emphasizing, when this is not cancer. That's just the natural aging of the prostate gland that swells up, becomes enlarged, starts compressing the urethra. That's not cancer. Happens to everybody. That's a man. Now, let's go to prostatitis. anytime you see the word itis, it means an inflammation. So prostatitis is inflammation of the prostate gland. So that's it's not uncommon. 10 to 18% of men in Australia have prostatitis. That's 1 out of every 5 men. That's pretty high, to be honest. And it's caused by either inflammation or infection of the prostate gland, and then you get swelling of the prostate gland and pain. So it's an infective process. It's an inflammatory or infective process, most commonly infective. It leads to urinary problems, sexual dysfunction, general health problems. You know, the person is tired, they feel depressed because it's pain in the pelvis all the time. There's a constant chronic pain, and then there's problems with urination as well. So really in a bit of problems here. And it of course occurs most often in the young and middle-aged men, because that's the age group that people are more at risk of getting prostatitis. That's the age group, the young and middle-aged, because of the nature of what it is. Infection is the most common, not the only one, but infection is certainly one of the most common reasons for it. And young men tend to do things that get infected, as you know. So what are the common manifestations of prostatitis? This is the inflammation one. What's the more common problems? Well, pain or discomfort is the most common thing, particularly in the perineal region, which is between the scrotum and the anus. That sort of middle piece that bars between the scrotum and the anus. So you get this perineal pain, very uncomfortable, that they get. They get pain in the penis itself. Quite often the tip of the penis gets painful. They get it in the testicles. They get it in the groin. That's in the groin part. They feel this deep pelvic pain, deep in the pelvis. They get this pain. They know a lot of pain, a lot of discomfort. It's not a comfortable one, and it's not something that you'd wish on anybody. But that's some of the symptoms. Not only do they have pain or discomfort, they also have urinary symptoms as well. So they get frequency or urgency of urination. They want to go to the toilet all the time, or they're going to the toilet all the time. You get burning when you pass the urine. You get poor urine flow. So not only is painful, is not passing and not voiding well, they find it difficult to initiate. Initiate means to start the urine. They sit standing up in front of the toilet and just can't, because it's so painful, they can't initiate the urinary stream. And then some of them would get a discharge from the penis. It's not necessarily always, but a discharge in an infective process is what can happen. So we've discussed benign prostatic hypertrophy, which is the realm of the older man. We've discussed prostatitis, which tends to be the realm of the younger man, because it's more infective and inflammatory. Now we want to discuss prostate cancer, which is the main thrust of what I'm going to be speaking on this afternoon. Prostate cancer. So, what is prostate cancer? Well, prostate cancer is a situation in which there are abnormal cells within the prostate gland that grow more quickly than normal cells. Abnormal cells that grow more quickly than normal cells in the prostate gland. And these abnormal cells are said to be malignant. Malignant being they're cancer. So we are producing cancer cells all the time. Our body produces cancer cells all the time. But the reason we don't succumb to cancer is that we have an active and effective immune system that deals with it and causes the cancer to become destroyed by apoptosis, and apoptosis means cell death, and it also has the scavenging. The white blood cells is able to scavenge the cancer. So that's why many of us don't get it. But it is a more common condition as you get older, because your immune system isn't working as well as it should, and therefore the cancer cells are able to break through. Now, prostate cancer is the second most common cancer diagnosed in men in Australia, and I think in America as well. But it's the third most common cause of cancer death in Australia. So it's the second most common cancer, and it's the third most common cause of cancer death. That includes male and female. So it is very common. So 1 in 7 men will be diagnosed with prostate cancer by the age of 85. Doesn't mean you won't get it before. Many men are getting it in the 60s and 70s, 50s. Some people are getting prostate cancer, and there are reasons why that's happening. Why is it coming to the realm of the younger age group? We're seeing it in young people now, relatively young. In the 50s, we're seeing 50-year-old men with prostate cancer, which is not something that we would normally expect to see. But 1 in 7 by the time you're 85 will have prostate cancer. 63% of cases diagnosed in men over 65. So it tells you most people who have cancer are over 65 years old, most people. But I dare say it doesn't exclude getting prostate cancer when you're younger. It's just the majority. Over 2/3 of them will be men who are over 65. So those are some statistics of the Australian population here, and it gives you the list of this is the number of deaths by in men. So lung cancer is the most common. This of course is in Australia, but I think it's mirrored in most Western worlds. And then the second common cancer is prostate cancer, and then after that you have colorectal cancer, pancreatic cancer, liver cancer, melanomas, leukemias, lymphomas, and so on. But certainly in the top rank, the race for the top, you have lung cancer and prostate cancer. And that is going to become relatively more, because as men stop smoking as much, the rate of lung cancer is going down, but relatively the relative rate of prostate cancer is going up. And as men stop, reduce the amount of smoking for health reasons and so on, you may find that prostate cancer may emerge to be the leading cause of cancer death in men over the next few years. About 3,500 Australian men die from prostate cancer each year, which means that more men die from prostate cancer than women die of breast cancer. Now we see quite a lot of attention is on the news. You have Breast Cancer Week, and rightly so it should be. Rightly should it be. But in fact, more men are dying of prostate cancer than women are dying from breast cancer, and yet there isn't that awareness, there isn't that movement to make men aware of this, this really potentially deadly disease called prostate cancer, and how we can address it, how we can prevent it, and what we can do to deal with it as a medical issue. And these are important questions that need to be answered, because it is affecting a lot of people. Sometimes we know of women who get breast cancer, and it's a big deal. It's a big deal, and as I say, it should be too. But yet we don't pay any attention to a disease that's even more prevalent, more common than breast cancer, and that's prostate cancer. That's why I felt impressed to deal on that subject today, because I wanted to raise the profile, raise the bar, let everybody know this is a problem. This is a problem. And it's going, well, I wouldn't say undercover, but it's not as given probably the amount of attention that is due. So if you're looking at the 2019 statistic, 1 in 3 men, 1 in 4 women will be diagnosed with cancer before the age 75 in terms of the causes of cancer, common causes of cancer. And so I've put common causes of cancer just as a comparison. So if you look at cancer, 1 in 3 men, 1 in 4 women will be diagnosed with some form of cancer before they're 75. I mean, those are frightful statistics. Frightful statistics. But what are the common things to look for? Lung cancer, common. Colorectal cancer. Look at number 3, prostate cancer. Number 4, breast cancer. Number 5, pancreatic cancer. Then you have a number of other cancers that come up, cancer of unknown origin, liver cancer, leukemias, melanomas, lymphomas. But if I were to look at the top 3 or top 4, because it affects women, lung cancer, colorectal cancer, and then prostate cancer, followed by breast cancer, and then pancreatic cancer. So those would be the top 5 things that you really have to be aware of in the cancer realm. I mean, there are things like brain cancer and all that sort of thing, sure. And they do affect a certain percentage of people. But they are not the common things. Common things are still common, and we ought to know what the common things are. Because if you know what the common cancers are, and if you know what the triggers for those common cancers are, you might be able to prevent yourself from getting them. And that's really why this is a preventative approach. How do we deal with men's health, preventing disease? Because sometimes, they say prevention is better than cure. Sometimes there is no cure. Sometimes prevention is the only cure because there is none. So it's important for us to be aware of that. So let's look at prostate cancer and a little bit of the management, anatomy to management. What's the anatomy like, and how is the management strategies like? What can we do to prevent it, or at least be aware of it? If you get it as a man, or if your husband or your partner or your son or somebody gets it, how can I be intelligent about it? Because when you go, a lot of the times when people go to the doctor, they don't know anything about the disease, they don't know what question to ask. And therefore you are at the mercy of that information. You need to know the information so that when you go, you can have an intelligent conversation with your doctor regarding what to do, what strategies to take, what's the best approach to use. This is something you should do. So I wanted to pass that little bit of information on by looking at, first of all, the anatomy of prostate cancer, and how what will be the common anatomy, and what sorts of questions you need to ask, and how can you know what the problem is. Well, first of all, let us discuss how we divide up the prostate. This is called prostate zones. So we divide the prostate into different zones, 4 zones anatomically. The first one is called the peripheral zone, which is the lightest brown here. It's the peripheral PZ, the peripheral zone, which is the outer layer of the prostate gland. When you go a further bit in, you get to what is called the transitional zone. That's in the deep brown here. That's the transitional zone. Between the transitional zone and the peripheral zone, you have the central zone. So that comes between the peripheral and transitional as the central zone. And then you have what's called the anterior fibromuscular stroma, which is the most anterior part. That's why it's called the anterior fibromuscular stroma. Stroma is a softer type tissue. So peripheral zone, central zone is the next layer, transitional zone is the third layer, and then the anterior fibromuscular stroma. So those are the 4 layers. Now, why that is important is in terms of when you have cancer in any of those areas, the prognosis is dependent on what part of the prostate gland the cancer occurs, because the cancer can occur in different parts of that gland. And depending on where it occurs will influence your prognosis, how aggressive it is, and what's your outcome. Prognosis simply means what's the outcome. Am I going to die tomorrow? Am I going to, the natural history might be a year, 6 months, what is it? That's called prognosis. So when you look at the peripheral zone, that's the outer zone here, 70% of cancers, prostate cancers, occur in the peripheral zone. And those cancers are more aggressive. And not only are they more aggressive, these are the ones, because they're close to the periphery, tend to invade the tissues outside. So they break through the capsule because they're so close to the outside. They break through the capsule and invade the periprostatic tissues, the lymph glands and the bladder, and they go into all sorts of places. So those are the more aggressive tumors if they're there. Then you have tumors that are in the transitional zone, which is the third layer. That's about 20% of tumors occur in the transitional zone, and those are not as aggressive, and of course they're further away from the periphery, which means to say that by the time they grow, they don't just sort of break through the capsule and get into the periprostatic tissue and in the lymph glands and start causing all sorts of problems. So if you have the majority, 70% are in the peripheral, but if you had to choose to get one, getting it in the transitional zone is better because it's further away. Now, the question is, what are the risk factors for prostate cancer? What exposes me to risk? And there are a number of things. Family history, we'll talk about this. Diet, chemicals, exposure to chemicals, hormones, including exposure to hormones, aging as you get older, and your race. Even the race can impact your genetics, can impact on that. So you have 2 elements of genetics. Genetics coming from your racial background, and genetics coming from your family history. So let's talk a little bit about those. Let's look at age. The risk of getting cancer increases rapidly from the time you're age 50, and age is considered the most important risk factor for prostate cancer, which means I can't control that. I can't control not getting old. But it is the highest risk factor. The fact that we get old, our immune system becomes dysfunctional. It's not working as well. And therefore, we don't have that ability to clear the body of cancer cells as effectively as a younger person. So age is one of the major factors for prostate cancer. Another factor is family history. That's genes. So if your father or your brother has prostate cancer, particularly at a younger age, there is a high chance you will get it as well. It is in your genes, genetic predisposition. There are a number of genes that are called mutations, and these are classed as the BRCA genes, the BRCA1 and BRCA2 genes. BRCA1 and BRCA2 genes tend to be the genes we look for in females because they're associated with breast cancer and ovarian cancer. So that if you have ovarian or breast cancer, a high percentage of those people are BRCA positive. But if you're BRCA positive, or you have a family history of BRCA positive genes, in other words, your sister has breast cancer, or your mother had breast cancer, ovarian cancer, it's genetic, then you are at increased risk because the BRCA genes are a predisposing factor. And then there's a number of genetic conditions called Lynch syndrome, which is really dealing with colorectal cancer, hereditary non-polyposis colorectal cancers. So it's cancer without a polyp. And that's called Lynch syndrome. That person has a high incidence of developing prostate cancer as well. All right, so we've discussed age, we've discussed genes, the family history. What about diet? Is there any dietary factors? Now, this is important because this is an area where we can control. I can't control my age. I can't control my family. They say if you want to be healthy, the best thing you can do is choose your parents well. But really, we can't choose our parents. So what about diet? Well, a diet that is high in fat and low in fresh fruit and vegetables tends to predispose you. High fat, low fiber, low fruit diet. Poor dietary habits like a lot of highly processed food, including refined and trans fatty acids, lots of sugar, lots of processed carbohydrates, definitely has been shown to predispose you, line you up, put you in the line of prostate cancer. There also seems to be an association with the lack of eating certain types of protecting vegetables called the cruciferous groups. So like cauliflower, broccoli, Brussels sprouts, and so on. You have a high risk of aggressive prostate cancer if you're not consuming this type of food. So diet is important. Well, we also have race, another genetic factor. Men of African descent are estimated to be 73% more likely to develop prostate cancer than white men, Caucasians. So though the black skin protects you from the sun, for example, and your ability to absorb vitamin D, there's a high incidence of prostate cancer. That might be a hormonal effect. Asian men who live in Asia have the lowest risk. But when these Asian men, like the Chinese and so on, Japanese, when they come to the West and they eat the Western diet, their risk becomes the same as a man in the Western world, a white or black person in the Western world, which tells you that diet plays a very big part in this, in the onset of prostate cancer. So race is important. African race more than the white race, the Asian race less than the white race. So black, white, and Asians in that order of protection. Then obesity or being overweight. A number of studies have shown that there's a greater risk of developing aggressive prostate cancers, and the recovery is slower after surgery, and there's a greater risk of dying from prostate cancer if you're overweight or obese. So carrying excess weight has a lot of disadvantages, and one of them has to do with prostate cancer, the risk of developing an aggressive tumor. If they do surgery, the risk of recovery is slow, and you also have the higher risk of dying from the disease. So weight management is a very important factor. A couple others, again, we have smoking, tobacco, and drug use of various kinds. Again, there's no doubt that tobacco is an inhibitor of the immune system. Things like the lack of exercise and a very sedentary lifestyle. Moderate exercise promotes immune health. Aggressive exercise, by the way, does not. High intensive exercise has been shown not to actually can reduce the immune function. People who are super athletes and so on, in fact it shows that you can reduce your immune function by doing that. But having some exercise is very crucial to the immune system. And then of course we have vitamin D levels. So they looked at studies of people who live north of Philadelphia versus those who live south of 40 degrees latitude, and they found those who are living where there is little or less sunlight have a high incidence of dying of prostate cancer than those who live in the areas where there is more sunlight. And sunlight is a cofactor for with vitamin D production. So vitamin D is so important in good health, and it's also it's a protection against prostate cancer. So with that in mind, there are a few others I want to tell you. There's excessive calcium intake, particularly from supplements. We should not be using calcium supplements. Now, there are combinations of calcium, magnesium, vitamin D, boron, and so on, all in this very good. That's okay. But a pure calcium supplement is not a good plan. They have shown that 20 years ago plus, it was shown that calcium supplements are not good. It's not good for your bone. It doesn't go into your bone. It goes into your joint. It goes into your kidneys, give you kidney stone. It give you bladder stones. It give you gallstones. Calcium supplements unopposed is not a good supplement to use. But it is linked, of course, to prostate cancer as well. We know that exposure to certain things like herbicides and pesticides can impact and can cause prostate cancer. Again, because those are toxic to the cell, and they cause the cell to degenerate and to produce cancer cells. Then we have prostatitis. There's some question as whether recurrent prostatitis, not a single episode, but whether recurrent prostatitis can predispose you to a high incidence of prostate cancer. And the other one is high testosterone levels. Now, they think that is probably why maybe in some of the African races there is a high incidence of prostate cancer, whether the testosterone levels might be impacting on that. But they're also looking at people who use supplemental testosterone. A lot of athletes, they use the androgenic supplements and testosterone so they could build bulk and muscle. But there is a big chance that that could also lead to prostate cancer in the later times. So that's giving us a bit about the risks and associations of prostate cancer. A nice list that allows us, at least we have a few things we can work with. Some things we can't help, like aging and genes and so on, except for monitoring purposes, that we are more at risk. You want to be monitoring yourself a little more. Some things we can. So what are some of the symptoms of prostate cancer? What would be some of the things that you have to watch for? Now, I do hasten to say that these symptoms of prostate cancer are overlaid by symptoms of BPH, benign prostatic hypertrophy, which we spoke about, the first case we spoke about, the first condition. Benign prostatic hypertrophy gives you a lot of the symptoms that you see in prostate cancer as well. And that is what makes it a little bit more difficult to identify, but we will go through some of the things that you can look for as well. So the first one we're looking at is the problem of difficulty of urination, the urinary system. So people who feel burning or painful sensations when they pass urine. People who are having trouble starting and maintaining the steady stream of urine. They're painful, and it's very difficult to, they're taking a long time for it to start. A very weak urinary stream. Now that normally implies that the urethra is being blocked or compressed. That could happen with benign prostatic hypertrophy, but it certainly can happen with a tumor. Dribbling or leaking of urine, more frequent need to urge or urinate, excessive urination at night, or urinary retention. Again, all of those can happen very simply with benign prostatic hypertrophy, BPH, which is benign, it is not cancer. But it will also happen with somebody who is developing prostate cancer. So there's an overlay of symptoms. Some other ones is sexual problems, including erectile dysfunction, painful ejaculation, or decrease of the amount of fluid ejaculated. Now again, all of that could happen as you get older, as the prostate gland becomes enlarged as well. But you do have to know them. So it's a symptom of benign prostatic, but then you could happen with prostate cancer as well. This one is the one that you will have to watch for. Whereas the other two set, the urinary symptoms and the sexual dysfunction, can happen with BPH, benign prostatic hypertrophy. This one generally does not happen with BPH, blood in the urine, hematuria. That is not a common feature of benign prostatic hypertrophy. So you get blood in the urine you have to look for. Pressure, pain in the groin and rectum can happen with BPH, but it's certainly very common with cancer as well. And this is the one more related to if you have a spread of the tumor. Pain or stiffness in the lower back, hips, pelvis, or thighs. So because prostate cancer can spread outside of the prostate gland and it can go to the bones, you can present with back pain. So if a person comes to me, I'm a pain specialist, and if somebody comes to me who is 25, 30 years old with back pain, I do what I have to do, send them home. If somebody comes to me, if they're 60 years old with back pain, I'll send them for a scan. Why? Because at that age, the incidence of prostate cancer is increasing, and it could be somebody who has got prostate cancer that's in the peripheral zone that has spread out onto the bone, and now it's affecting the bone. So you have to have what's called a high index of suspicion. Thinking, well, what's going on here? So back pain, pelvic pain, perineal pain, thigh pain, it's not something just you pass by in the elderly age group. You've got to check it out, make sure. So how do we diagnose prostate cancer? You come to me as a doctor, you go to your GP. How do we diagnose prostate cancer? Well, first of all, you do a physical examination and a good medical history to discuss some of the same symptoms we discussed just now. Part of that examination is a digital rectal exam, which means if you put your finger in the back passage of the man, because you can feel the prostate gland from the rectum. So if you put your finger in, you can palpate or feel the prostate gland with a gloved finger, and you try to feel if it is, how large it is and how painful it is. Those are the two questions you'd look for. Then we do a particular blood test called a PSA, prostate specific antigen, PSA, which is a protein that is produced by the prostate gland that goes into the blood. And so the higher the level of the PSA, the higher the risk that it might be cancer. Now you can get it from other reasons, but if you have very high levels of PSA, generally the most common reason is prostate cancer. So that's the sort of examination, your physical examination, your medical history. That's the digital rectal exam. I'm just giving you a picture of it. The doctor puts his finger in the back passage and tries to feel that gland next to the bladder, and it's very easily felt. The PSA, the prostate specific antigen, that's the blood test we do, and you look to see what level it is, and we'll discuss that. Now, once we've done those, if we're worried, you do what's called a transrectal ultrasound. So what you do is you have a ultrasound probe, and you pass the ultrasound probe just like you do the digital exam. You pass the ultrasound probe into the rectum, and we use that to look and identify the prostate gland and to look for any abnormalities in it, bumps and lumps and very irregular surfaces. And then you'd also use that opportunity to biopsy that prostate gland. So if we felt something, you do that also if you felt it on a digital exam. When you do the PR exam, you feel this irregular, craggy, horrible prostate, you'd put your finger and you take a biopsy. But it's better done with ultrasound. That's much more accurate. And we take a sample of that prostate gland where we think we're worried. The other test that we will do is called an MRI, magnetic resonance imaging, a PET scan, or a bone scan. So we do all of them actually in order to identify the prostate gland specifically and to look for any of these tissue, any of the prostatic tissue, if it's cancerous, that has spread outside of the body. So we do a PET scan, an MRI, or a bone and a bone scan. All three are actually done to try and identify how big this gland is and has it gone anywhere else if it's a cancer. And of course we talk about the biopsy, removing a small sample. And when we take this small sample of the prostate gland called a biopsy, the pathologist gives us a score. Now these are the important things you need to know. It's called the Gleason score. A score between 2 and 10 indicates the likelihood of the tumor spreading outside. So they do this called a Gleason score. If it's 2, then it's likely not to spread. But if your Gleason score is 10, then more than likely it has already spread, because they're sampling bits of the gland to see how far out it's spread in the prostate tissue. And of course also where it occurs, if it's in the transitional zone versus the peripheral zone. So once you've done a biopsy, you want to go now what's called staging it. You've got to stage, what's the stage you're at. So you get a prostate, say you've been diagnosed with a high PSA, and they say, look, we've done your biopsy. I'm sorry to say, sir, you've got prostate cancer. What you want to decide is, what stage are you at? What stage are you at? Obviously, the lower the stage, the worse the prognosis, the worse is the outcome, the shorter your lifespan. So we do what's called staging. So the stage determines where it has spread to, what part of the body it has spread to, and it helps us to plan the best treatment. Now, we stage the cancer using several things, 4 things in particular. One, in terms of what is the size of the tumor and the extent of the tumor. Is this a small tumor, or is it a big tumor? Is it deep inside the prostate gland, or has it spread outside the prostate gland? So that's the first thing we have to ask. What's the prognosis? I need to know how big it is and where it's gone. So we look at the spread to the nearby lymph nodes, which is right around the prostate and the bladder. If it's locally spread, that's better. But if it's gone all over your body, well, that's not good. That's extensive metastasis. So we look to see if it's spread. That's why you do your PET scan. You look at the PSA levels, because the higher the PSA level, generally the bigger the tumor is growing, and how fast it's getting there. And we look at the Gleason score based on the biopsy. Now, once that's done, we come up with 4 stages. Stage 1, the tumor is not spread outside. The Gleason score is 6 or less, so it's lower. And the PSA is less than 10. Normally your PSA should be less than 4. So if it's less than 10, 4 and below is what you're looking for. The smaller the number, the better. But if it's 10, but less than 10 and less, then that part is stage 1. Stage 2 has 2 segments, 2A and 2B. In 2A, it has not spread outside. The Gleason score is still low. Your PSA now is between 10 and 20. Or the Gleason score is high and the PSA score is less than 20. Either way, that's stage 2. There's a stage 2B, where it's now spread outside the prostate. So it's gone through the capsule. It's outside. You put your finger, you could feel the tumor on a digital examination. Your Gleason score is high, 8 for example. The PSA is high because it's a larger tumor that's gone outside the capsule of the nice contained capsule of the prostate gland. So that's 2B. Then you have stage 3, where it has gone beyond the prostate. It's gone into the lymphatic, the seminal vesicles, but not into the lymph nodes. The Gleason scores are elevated. And finally, in stage 4, it's gone to the rectum, to the bladder, to lymphatic tissues, or it's spread distantly to some other part of the body. Stage 4 is therefore the worst stage, when it's gone all over the pelvis and spread all over your body. That's a bad stage. It means generally your outcome is not so good. So we've discussed now the staging. Let's discuss how do we classify prostate cancer. Well, we use a system called the TNM system. So these are things that you should note, make a note of. The TNM system. So when you go to your oncologist, when you go to your urologist, he has this. We have these notes that mark TNM. What's your stage? You have TNM. TN stands for the tumor category. N stands for the nodes that are affected. M stands for the metastasis, whether the cancer is spread all distant, go to your head, go to your lung, go to your liver, and so on. So that's what we look at, the TNM system. What's the tumor category? Whether the nodes are distant or local, and whether it's gone all over the place. The other system we use for classifying is the Gleason score. We spoke about that. That's off a biopsy. And a 2 would be a non-aggressive one, but if you're at a 10, that's a very aggressive tumor. So we need the Gleason score. The other one, of course, is based on the PSA, which we mentioned before. So now that we have that, the TNM, Gleason score, and the PSA, the question is, what do you do now? So I'm sorry to say, sir, you have got prostate cancer, you're a T2, N3, M4 stage, which makes it very serious. Your Gleason score is 10, your PSA is 200. This is not looking good. You know, that's the kind of conversation you would have. So what's the treatment? What are the conventional treatments? What are the medical conventional treatments that we would do? Well, if it's a low-risk person, somebody who's got a tumor in the transitional zone, it's a slow-growing, so not an aggressive tumor. The reason we do the biopsy is because we want to see what the tumor type is. There are some tumors which are very slow-growing. Very slow-growing. You will die with your tumor, not from your tumor. Does that make sense? Most men will die with prostate cancer, not from prostate cancer. Slow-growing. You die from everything before prostate cancer would get you. It's a slow tumor in the transitional zone. Don't bother. Forget it. Don't even think about it. Go eat, drink, and be merry. So those are slow-growing prostate tumors. And for those, really, it's just monitoring. You say, look, let's just keep an eye on you. Come back in every year. We'll just do a quick test, see, make sure you're all right. Most of the time, treatment is not needed. And sometimes it's been in the past, doctors were too aggressive in treating these types of tumors. In those type of tumors, let's leave them alone. The man will die many, many years before the tumor ever becomes a problem. So that's called active surveillance. Then those which are now larger tumors which are growing bigger, which are starting to spread in the peripheral zone, for example, you can use hormone therapy. Remember hormone therapies. Remember we said testosterone is converted to dihydrotestosterone in the prostate gland. That's what gives you the androgynizing effect. Nice big muscles and beard and all sorts of things. But that DHT is also the one that can stimulate prostate cancer once you get it. So the same thing that gives you the big body and the beard and the deep voice, as you get older, that same DHT can cause if you have prostate cancer, can cause the prostate cancer to grow and to spread. So we use hormones. It's called luteinizing hormone release hormones. And these are the same hormones that are used quite often for females with ovarian cancer. So they're used to suppress the production of the DHT, the hydrotestosterone, the DHT metabolite. And so a number of names of those drugs, Lupron and Zoladex and so on, Zytiga and so on. There are quite a few of those. And then there are some drugs which are used to stop the cancer cells from feeding on the DHT. So some will block the DHT production, and some will act directly on the cancer cell so it doesn't feed on it. So those are Casodex and Linandron and so on. So there are quite a few of them, and the doctor chooses which one is appropriate for the patient at the time. So that's the one to slow the cancer spread by blocking the hormone. Then there's radiation therapy. So this is where you use an X-ray beam directly onto, or sometimes you use proton pumps, these beams of protons, but they use X-rays or protons, and it is directed directly to the tumor. It's targeting that tumor like a beam, and it goes right onto that tumor and burns the tumor out. So that's it, to try and stop it from growing and spreading. And the stupid thing is growing and bigger and bigger. Instead of trying to cut it out, you use an X-ray to try and zap it. So that's called radiation therapy. Another therapy is called brachytherapy. Brachytherapy is where you use rods of radioactive material. They're radioactive rods, and you insert those rods into the prostate gland. So it's locally applied radiation, locally applied radiation. So these little rods, and you just pellet rods, well, it's not pellets, but rods, and you insert these rods all inside the prostate, near to the tumor, in an attempt to surround the tumor with rods of radiation, and that stays in, it has a certain half-life and so on. It's a low-risk disease, low risk, and you use it only for low-risk disease, brachytherapy. If you're using high-risk disease, people who've got big tumors that's spreading, you need to use hormone therapy, you need to use external radiation beam therapy, which is EBRT, external beam radiation therapy, and brachytherapy, where you put the rods in the prostate gland. So the decision as to what you do depends on how big this tumor is, and on how likely it is to spread. Because a lot of times when it spreads, you can't do anything, it's too late. Horse is bolted to the stable, you can't catch the horse, it's gone. So you have to use your therapies wisely in terms of where you are at each stage. So that's called brachytherapy. And then, of course, the other one is chemotherapy. Chemotherapy is cancer therapy, liquid cancer therapy. And that's where they put the chemotherapy in your arm, or you take it as a pain in order to target the cancer cells, on the basis that the cancer cell is more susceptible to your chemotherapeutic agent, your drug, than your normal cell. Mark you, that's not always true. Chemotherapy would kill any rapidly dividing cell, Because cancer divides so rapidly, the basis of chemotherapy is, well, if I give you this drug either in the vein or orally or both, then the cell that is dividing as rapidly as the cancer will be the first one to get affected. And because it's the first one to get affected, it's the first one to die. So they sometimes go on the basis that for every 3 cancer cells you kill 1 normal cell, like a 1-to-3 ratio. Turns out sometimes it's high, sometimes it's 1-to-1. For every cancer cell you kill a normal cell as well. So chemotherapy can be quite disastrous for some people. They lose their hair, they lose their skin, their bowel. It can be quite an event, and so they choose that very well for the tumors. Okay, and it's only recommended after hormone therapy doesn't work. So you use hormone therapy, it doesn't work. They say, I'm sorry, sir, we tried you on the hormone therapy, it doesn't work. We need to go something because the tumor is spreading. So that's where you go for chemotherapy. Now, there are a couple of surgical approaches we use. One is called cryotherapy, where we have a special probe, and you take that probe and put it into the tumor, and you freeze the tumor off. We freeze the tumor. You use cold to destroy the cancer cell. The one that is becoming more popular now is called immunotherapy, or biological therapies. They're called immunotherapy. And what they're finding out, what scientists and medical doctors are finding out, is that the immune system properly activated is its own defense. Now, we could have said that before, because we knew that from just pure nutrition and health. You want to maintain your immune system, because if your immune system is strong, it will attack the foreign cancer cell and destroy it by apoptosis, phagocytosis, and what's called cell senescence. It destroys the cell and engulfs it and gets rid of it. But if your immune system is weak, then the cancer invades your body. So one technique is called immunotherapy, and we think that the doctor of the future, the cancer treating doctor of the future, will use largely immunotherapies rather than chemotherapy and some of these other ones, getting your immune system to recognize and to fight the disease itself. So there's agents, but it's terribly expensive, and so most of this has to be supplemented by government funding. Some other ones that is used to reduce your BP, your DHT is things like finasteride and dutasteride. Those are 5-alpha alpha reductase inhibitors. It tries to reduce the DHT levels in your blood, and it is found that men who are diagnosed with prostate cancer, these drugs can help, for sure. There's a large study done involving more than 18,000 men over a decade, and they found that finasteride can reduce prostate cancer risk by about 25% by reducing the DHT level, which we know if you have prostate cancer, the prostate cancer feeds on it. Then there's surgery. This is radical surgery, as it's called, radical prostatectomy, where you remove the prostate gland, the surrounding lymph tissues, and the tissues around the prostate gland, the periprostatic tissues, so that you try and get the tumor, all parts of the tumor, before it spreads. You know, it's like taking out the breast before the breast cancer spread, or taking out the cervix before the cervical cancer spreads. It's the same one. They take out the prostate gland before it spreads. It's a major undertaking, and not done very much these days, but except in very aggressive tumors. So we've discussed the sort of medical approach. Conventional therapies is what we've looked at, the medical approach. And there's a place for that, particularly if the tumors are very aggressive. The big thing we want to say is, number one, is how can we prevent the disease in the first case, if possible. It's hard because aging is a factor. But if we have it, how can we slow down its growth? Well, a couple of things. We know that stress is a killer. Stress has been shown to be linked to all sorts of cancer. And so we talk about doing things that help you to deal with stress, mind, body conditions, dance, exercise, acupuncture, spirituality, music therapy, all those sorts of things which will help reduce stress, biofeedback. There are lots of techniques that are available that help people cope with stress. And I think trusting in divine help is one of the big things. Asking God to be with you and really just putting your hand in His and your health in His hands so that He can help you with your stress. That's very important. So relaxing in nature. Nature is very good, especially our lakes and so on, sea, where there's a lot of negative ions. All of these things are very healthy ways in which you can rejuvenate the cells. Because we produce a lot of positive ions on our surface, like you're near to the lights. The lights are showering positive charges on my skin. You're not seeing it, I'm not seeing it, but I'm in the presence of lights. It's showering positive charge on my skin. That's why people get static sometimes when the wind is very cold. You get the static when you touch a metal door. That's because you've built up a number of positive charges on the skin. So being in a nice open environment where there's negative ions, like a waterfall or the sea or the river, or even in the forest, those areas where there's negative ions, it helps to decontaminate you, all of this positive ions that we build up. Very important. Take care of yourself. Try to exercise. Get enough sleep. Sleep is a good night's sleep is the best thing you can do for a full day's work. Getting a good night's sleep is important. It is boosting. We talk of all the things that we would talk about, sleep turns out to be probably one of the most important things that you can do for your health. Sleep. And most of us don't get a good night's sleep, but it is so vital, so crucial to bowel regeneration, brain regeneration. It is probably the most important thing that you can do for your health, is get a good sleep, good night's sleep. Exercise, we mentioned before, is very important to boosting your immune system. Exercise reduces inflammation, improves circulation, supports the immune system, can control your weight. It can also reduce stress, deal with depression and anxiety. A number of studies have shown that from Stanford University, that people who exercise, when you exercise, it reduces the risk of getting prostate cancer. And that reduction is between 10 and 30%, which you would consider pretty significant. Just by exercising, you could reduce your risk of getting cancer between 10 to 30%. Daily exercise, 5 days a week, at least 5 days a week. 5 days a week is probably all you need to get enough exercise to keep you in the protected circle. So get enough exercise, that's the key. get enough exercise. A couple more things. Educate yourself about the disease. That's what we're doing here. You know, trying to give you information of the latest treatment options, put you more in control so that you know what you're doing, you can ask the right questions, you can approach this thing in a very a sensible way, and a way that would help you to get the best out of your situation. Because you have to evaluate your own circumstance and determine what's the best for you in your situation. You know, you'll have to lean on friends a lot, because this thing is can be catastrophic, depending on how it is. It can be catastrophic. You have to be going for regular treatment. Sometimes you have to go to another hospital down the road. Maybe you have to travel to get to the proton beam therapy, you know, or to get appointments with your urologist. So you know, it's very easy to become lonely and to feel left out because of all the things that you're required to do if you're diagnosed with prostate cancer. Sometimes you become overwhelmed. Become tired because of all the treatments you have to go and undergo, and then you still have all these tasks that you have to complete. So you know, you can get worried. All of these things can reduce your life force, as it were, and make it difficult for you. So talking to people, getting a support of friends and family and church is really important in this difficult hour. Now here are a few things you really can do, everybody can do. Eating a healthy diet and managing your weight. That is definitely one of the most important things you can do. Choosing your food well, especially avoiding processed meat and factory farm meat, you know, all of these sort of things, and trans fat foods that are high, like fried foods and fatty foods and margarines and highly processed foods. Those are the things you want to be careful about. Be very careful about those highly processed foods. Not saying if you eat a little bit you're going to die. I'm not suggesting that at all. But certainly if you had cancer, you'd want to be very careful about the highly processed foods that we buy in the supermarket, get into the little vending machines and so on. You'd want to be chocolates and all this sort of thing. You want to be really, really careful of those. They're high in sugar. Avoid the trans fatty acids, you know. Again, sorry, you know, these are important things. A lot of the fried foods, fast foods, these are highly processed foods that you go by, you know. And as I said, I'm not implying that you can't have a little bit now and then, but certainly don't want to be feeding or feasting on that on a regular basis, because that suppresses your immune system and promotes cancer growth, including prostate cancer. So a good fish that might be worth is anything with the omega-3 fatty acids. So a wild caught fish like salmon, and they have a lot of these fishes with high omega oils. Those have been shown to be protecting against all forms of cancer and also prostate cancer. Veggies, making sure you get your vegetables every day. 2.5 cups of veggies every day, your vegetables every day is a good anti-inflammatory diet. Very good anti-inflammatory diet. You know, your broccoli, your Brussels sprouts, your cabbages, cauliflowers, kale, kohlrabi, and so on. Those are very protective against cancer and specifically also prostate cancer. So those are the ones as part of your anti-cancer diet. It would be worth doing those sorts of things on a regular basis. You look for foods that are high in antioxidants. So an antioxidant becomes the scavenger. It's a scavenger. It becomes a substrate for the reactive oxygen species. So what happens when you have cancer? You start to produce what are called reactive oxygen species, ROS. Those reactive oxygen species tends to be elements or with an electron that's unbalanced, and they look for something to attach to in order to balance themselves. These reactive, so they're elements in this reactive process of disease, and they will attack your normal cell because they want to balance themselves, and then change that normal cell into a cancer cell, and that's how the reactive oxygen species works. But if you have a high antioxidant food that you're taking regularly, it becomes a substrate for these reactive oxidant species. So instead of going and attaching to a normal cell, they will attach to the antioxidants. That's how antioxidants work. So, you know, green leafy vegetables of all kinds, the berries, the fruits, the sweet potato, the asparagus, bell peppers, veggies, herbs and spices, olive oil, green tea, cocoa, spirulina. There are quite a lot of range of these groups that are then. But you can buy the antioxidant juices. So we get something called super berry juice. It contains a number of berries: blueberry, blackberry, strawberry, grapeberry, grapes, and a couple other berries. And you form out this super berry juice. You can buy it in the supermarket. That's a very good antioxidant base for general toxins in your body, for sure. Foods high in zinc and selenium, because the prostate gland requires zinc and selenium. So you want to be foods high in zinc and selenium. Zinc is an antioxidant, selenium is an antioxidant, but they have both been shown to have anti-cancer protecting effects on their own, independently. And both zinc and selenium are needed by the prostate gland for their normal health. So you'll get in things like Brazil nuts, pumpkin seeds, dark chocolate, sesame, wheat germ, chickpeas, and so on. So those are things that, it just gives you a good mineral base to protect yourself and to keep your immune system working. Calcium supplements you should avoid. Supplements with calcium you should avoid because it puts you at a high risk. So if you're on a calcium supplement, you want to talk to your doctor about that. And although you need calcium, you don't need calcium in that supplemental type. You'll get it from green leafy vegetables, from fermented dairies, not normal dairy, because that's not good that's unopposed calcium, by the way. Dairy is unopposed calcium. So milk is not the best thing to drink in any cancer, or generally, because the calcium is not available. That's the problem. Milk behaves like a calcium supplement. So you have to be very careful about that. But the fermented milks are good because they are bounded to a different compound. Don't smoke or drink, obviously, and we believe that alcohol and tobacco smoke and recreational drugs are the ones that are partly destroying the fabric of the body's immune system. So you want to avoid that sort of thing. Don't smoke cigarettes. Don't smoke illicit drugs. Don't take illegal drugs. Don't drink alcohol. These are all things that it's just common sense things that you have to do if you want to protect yourself. Sleep enough and learn to manage your stress. We keep saying that over and over. Stress, a number of studies have shown that stress is a major contributor to disease. So look at hobbies, going into the community groups, going to church, and just really deal with the stress factor in your life. I know it's hard, particularly in this day that we're in, with all the lockdown and so on, but managing your stress is one of the most important things you can do. Remember, the Bible says in 1 Corinthians 6:20, "For you are bought with a price. Therefore glorify God in your body and your spirit, which are God's." So it's good advice. You want to be healthy in your body and in your spirit, okay, which belongs to God. That's your spirit and spiritual life. Treat other health conditions. If you have other medical conditions, diabetes, high blood pressure, whatever it is you have, high cholesterol, depression, you want to treat other medical conditions, because every medical condition has an impact on your total health. That's the problem. Nothing is not having an impact. It's having an impact on your health. So if your blood pressure is not well controlled, it impacts your health. If your diabetes is not well controlled, it impacts on your general health. So you want to get your health conditions well attended to. Get to your GP, your doctor, and just make sure that everything is ticking over as best you can. Talk about your supplements. Get your diet looked at. Address the issue of cancer. If you have cancer somewhere else already, you want to get those cancers dealt with as well. There's nothing that stops you from having one cancer and prostate cancer. You could have colon cancer and prostate cancer, lung cancer and prostate cancer. So you want to deal with any serious metabolic condition, so that you're giving yourself the optimum opportunity to get well. Now, I want to just close off with a few more general things. 6 drinks that will help you fight cancer. So these are things that research has shown they are cancer fighting in their nature. So they not only protect you, but they help fight the disease. So 6 drinks that have been shown. Coffee, but they're non-caffeinated. There are problems with caffeine, which can speed your heart up and give you some arrhythmias and so on. But coffee has been shown to contain a number of powerful phytochemicals, antioxidants, including theophylline and theobromine, chlorogenic acid, and so on, quinic acid, cafestol, and caviol, and so on. They have a number of factors in coffee that have been shown to help you, but it's a non-caffeinated variety, non-caffeinated coffee. So there's certain studies have shown a reduced link between the use of coffee and liver, colorectal, endometrial, oropharyngeal cancers, and a number of other cancers. So that's one of those drinks that the evidence certainly is showing that, and again I emphasize we're talking with the non-caffeinated type. Green tea, black tea, white teas, a number of those teas containing catechins. These are polyphenol compounds containing EGCG, which is epigallocatechin. It's a polyphenol compound that has been shown that will attack prostate cancer. And it's found in green tea, black tea, white teas. Now you can get all of these in supplement forms, by the way, so that you don't have to necessarily drink green tea or black tea. You can get EPGC, EGCG in supplement form as well. And they think that's why long-term tea drinkers have a lower incidence of bladder cancer, stomach cancer, pancreatic cancer, among a number of other cancers, statistically. And green tea is an exceptional source of the EGCG, which is the epigallocatechin, and that has protective effects with prostate cancer. So here's a number of studies that have been published showing that ECGC inhibits tumor invasion, angiogenesis for tumor growth and prevents tumor growth and metastases. So I'm not just making these up. There are studies to support what I'm saying to you. If you have prostate cancer, you may want to go for 100% vegetable juices, your smoothies with the pulp and the fiber to ward off chronic disease in general. A number of studies have been shown that's very useful. A good choice would be a combination of the green vegetables, spinach, kale, kohlrabi, tomato, celery, herbs, and so on. So you have a vegetable juice. Again, you'll be surprised how much of this you can get now pre-made for you. Very easily available. 100% fruit juices, but no added sugar. So you want to be careful with fruit juices. I'll show you which ones in particular. But the berries are good. Blueberries, pomegranate, acai, the superberry things. Those are good juices to have, but try and avoid the ones that has a high sugar content. The ones that have dark-colored fruits, the berries are very powerful source of resveratrol, which is an antioxidant. And again, you can get resveratrol. I take resveratrol every day, but I take it in a tablet form. But you can get it in a berry form. The dark-colored berries are high in resveratrol. Okay. Grapefruit juice is another one that contains a number of phytochemicals. And a lot of research is showing that these chemicals can help you in the fight against cancer, including things like lycopene and beta-carotene and so on, vitamin C. So again, very, very good source. Pomegranate juice. Now it's interesting, the Bible talks about pomegranates. Well, it turns out pomegranate juice contains a lot of polyphenols that are anti-proliferative, which means they stop the proliferation or spread. Pro-apoptotic, which means they increase the cell death of the cancer. Anti-inflammatory, and it protects the prostate, the lung, the breast, and from a number of cancers. So pomegranate juice it's a very good juice, and you can get it mixed up with the berry. You can get berry and pomegranate all in one juice together. Some herbal teas, we talk about various herbal teas extractions we've mentioned before that have been shown to be very useful. Herbal teas which include ginger, chamomile, dandelion, chai, and a number of traditional herbal teas have been which are caffeine free have been shown to benefit the gut health and reduce inflammation. It turns out that much of immune system protection comes from the gut. From the gut. The gut has the largest immune system in the body. It's not the lymphatic tissues, it's not the lung, it's not the spleen, it's the gut. And gut health is another area. We're talking about sleep. Gut health is another area, the second area that is now being considered paramount into generally good health, gut health. And so that's a whole subject that needs to be looked at as well, and what things affect it. But herbal teas of the time we mentioned is shown to be very important to protect your gut health as well. So there's a 2019 review of herbal teas and infusion, which shows that certain types of cancers and digestive issues can be treated quite effectively by herbal teas. Very effectively by herbal teas. Amazing. Without even going to drugs and so on, just herbal teas. So these are important factors I'm giving you. We're talking about six juice. So here's the sixth one. Red wine in moderation. Now, I must say that the studies are not dealing with alcohol. The studies are dealing with the agent called resveratrol. Resveratrol. And resveratrol is the cancer-finding substance is red grapes, but it's found in a number of plants. I think they got it from one of the Japanese algae now. Most of resveratrol is actually coming from a Japanese algae. But the point is resveratrol has been shown to contribute to cancer-fighting cell and inhibition of cancer cell growth. Now, people get it from red wine because the alcohol extract of the red grape. But then you drink in the wine, the alcohol part. And the alcohol, we've already said you want to avoid alcohol. So you need to bear in mind the conversation I'm having here with you. Even though I say red wine, I'm not talking about red wine. I'm talking about the extract, which would be resveratrol, not the red wine itself, because then you're exposing yourself to the same thing that can affect your immune system. So there's a study in the European Journal of Cancer Prevention showing that wine consumption decreases the risk of cancer at several sites, including cancer of the upper digestive tract, the lung, colon, basal cell cancers, and non-Hodgkin's lymphoma. So resveratrol as an active ingredient is powerful. And it seems to significantly reduce the transcription. Transcription is meaning they transcribe it's like how you transcribe a letter. You take a letter and write it over. Well, that transcription, that rewriting of your cancer gene, because cancer is a gene, is reduced when you take resveratrol found in red wine extracts. Finally, consider a plant-based vegan diet. If you have cancer, you may want to move to a vegan diet to avoid exposure to a lot of the fats and oils and prepare the way it is prepared. A vegan diet might in fact be your safest option if you have prostate cancer. Might be your safest option. So ladies and gentlemen, that's it. I know I spent about an hour with you, but I think it's important for me to have done that with you. To try and summarize for you the three major conditions that affect men: the benign prostatic hypertrophy as you get older, the prostatitis in the younger age group, and the prostate cancer, which is a major problem for older men, and what to look for. What are the symptoms? What are the tests that are done for them? How do you diagnose it? How do you treat it? And what are some of the preventative things you can do, including things that you can control within your diet? Because diet is a factor. Now, you can't control a lot of things. You can't control the color of your skin. You can't control your age. You can't control your genetics, who your parents were, who your sister and mother happen to be because they have the BRCA gene. Those factors you cannot control. But what you can control, you should. Because that still gives you your best outcome. So ladies and gentlemen, you're standing at the crossroads. Health is a change in lifestyle. It's the choices you make. You have to choose. What I've tried to do is to show you the path. But ladies and gentlemen, the choice is yours. And so with that in mind, I close with the words of St. John the Apostle, who is one of the authors of in the Holy Bible. And I closed the way he closed his, or he said in his book. He says, "Beloved, I wish above all things that you would prosper and be in health, even as your soul prospers." And that's what I wish for all of you who are listening, male and female, that you would prosper and be in health. And to do that, you have to be intelligent and intentional. I like to use those two words. You have to be intelligent about it, i.e., that is, be informed. Be informed. The wise man says, get knowledge. but with all your knowledge get understanding also. So you want to be intentional and intelligent. When you get the knowledge, be intentional about it. There's no point having listened to me for this hour and a half that we sat, and you did nothing about it. Well, then that's not being intentional. Then your knowledge works against you. So I wish that everything we've said would have some impact on you, and that something I've said would make a difference to your life, to somebody who is struggling with prostate cancer right now. And that maybe something I've said may make a difference to you in terms of your stress, in terms of your life, in terms of your diet, and that you might see a longer life. And so I wish this for everyone, and may God bless you as you continue on this journey, as we continue on this journey to a better land, in another day, in another place. One day Jesus will come, we'll be in a better spot, better place, and I long for that. But I wish that for you, and I wish you good health. In Jesus' name. And thank you very much.